So you're welcome once again to Health and Wellness with Nurse Taiwo. Today I'll be discussing about a disease condition named diabetes mellitus. It refers to a group of diseases that affect how the body utilizes blood sugar or blood glucose. Glucose is very important for energy, for cells that makes up muscles and tissues. It's also the brain major source of fuel. So the major importance of glucose in the body is for what? For energy. So when diabetes mellitus occurs, it occurs because the pancreas doesn't make enough insulin or does not make insulin at all, or when your body isn't responding to the effect of the insulin properly. Normally, your blood carries glucose to all the body cells to use for energy. When this condition occurs, the glucose will build up in the bloodstream, causing high blood sugar, otherwise known as hyperglycemia. So don't even be bored though. Don't even tell me that you're bored, because I know that you're hearing some things, maybe some terms I'm making mention of, such as the insulin. I'm talking about pancreas. So let's go into the organ affected so that you understand me better. The organ affected, look at your screen, is the pancreas. It's an organ at the back of the abdomen. It's a part of the digestive system. The pancreas is an organ and at the same time a gland. An organ is a recognizable structure that has specific function in the body. While a gland, we call glands are organs that produce and release substances in the body. I'll go back to the diagram to see the pancreas. You can see that it has head. The head is the wider part that sits on the curve of the duodenum. The neck is the short part of the pancreas extending to the head, while the body extends upward, and the tail is the thinnest part of the pancreas near the spleen. Yes, so it has two major functions, which is the exocrine function and the endocrine function. So the exocrine function of the pancreas enables it to produce enzymes that helps with digestion, such as the lipase that helps to produce bile by the liver and breaks down fats. The amylase work on the carbohydrates, and the protease work on the protein. Then the endocrine function of the pancreas allows it to send out hormones that controls the amount of sugar. So types of diabetes mellitus. We have type 1 diabetes mellitus, an autoimmune disease in which the immune system attack and destroy insulin producing cells in the pancreas for unknown reasons. This one has unknown cause. So this type now, autoimmune, is when the immune system is fighting against itself. So in this case, they are fighting against the producing cells in the pancreas. For the type 2 diabetes mellitus, the body doesn't make enough insulin, or the body cells does not respond normally to the insulin. It is also called the insulin resistant diabetes mellitus. This is the most common type. It affects majorly adults, but sometimes children too. So we have pre-diabetes mellitus stage. So at this stage, the blood sugar are high, but not high enough to diagnose the person of having type 2 diabetes mellitus. So it's a stage before type 2 diabetes mellitus. They also have gestational diabetes mellitus, which occur during pregnancy in some pregnant women. This occurs because of during pregnancy, placenta release hormone that causes insulin resistance. So that is what allows these people to have diabetes mellitus while they are pregnant. So at times it goes away after pregnancy, but people that have it are mostly at risk of having type 2 diabetes mellitus, because also as a result of insulin resistance. So what are the signs and symptoms of diabetes mellitus? The first sign is polyuria. There will be increase in urine production because the glucose level in the blood is very high. So it's looking for means to go out of the body system. So it will go to the kidney, and then there will be increase in the formation of urine production, and then so there will be increase in thirst, which is known as polydipsia, to replace the lost fluid. There will also be fatigue due to the glucose in the bloodstream not getting to the cells and tissue. So the person will tend to be feeling tired. There will also be increase in hunger, polyphagia. There will be unexplained weight loss because there is no glucose in the body. So the body tends to be breaking down fats that are stored POD, which is a diabetes, a kind of diabetes related ketoacidosis. I will talk about that later. Also, there will be numbness or tingling in the hands and feet. Slow healing of sores or cuts due to the high glucose level in the bloodstream, so it will not allow the wound to heal on time. There will be frequent skin infection too because of the high blood glucose, and also there will be vaginal yeast infection for female too. So the causes of diabetes mellitus: first is the insulin resistance, which is the actual cause of type 2, where the muscle fat and liver, they are not responding to insulin. Can be caused by obesity, lack of exercise. Then also immune diseases, they are the one that causes type 1 types of diabetes mellitus. Also hormone imbalances that occur during pregnancy, that's for gestational diabetes mellitus. They cause what? Diabetes mellitus. Also acromegaly, Cushing syndrome, pancreatic damage, genetic mutation. Some people have it in their gene, so it's hereditary, so it can also cause diabetes mellitus. Then long-time use of HIV drugs, medications, and corticosteroids. All complications of diabetes mellitus include diabetes ketoacidosis, coronary heart disease, heart attack, stroke, arteriosclerosis, nerve damage, neuropathy, retinopathy, diabetic foot ulcer, skin infection, amputation, sexual dysfunction, hearing loss, etc. So how is diabetes mellitus diagnosed? It's diagnosed through a test known as the measurement of blood sugar level. So it's either fasting blood sugar, which is done on empty stomach, or random blood sugar, which is done even when the person has eaten. So blood sugar is measured with the aid of glucometer. So the unit is either in millimole per liters, you see then they write mol, or milligram per deciliter, you see them writing mg/dl. So for the normal fasting blood sugar level, you should have 70 gram per deciliter, which is also equivalent to 3.9 millimole per liters, to the range of 100 milligram deciliter, which is also 5.6 millimole per liters. Then for the random blood sugar, you should be having 100 milligram per deciliter, which is also 5.6 millimole per liters, to 125 milligram per deciliter, which is also 6.9 millimole per liters. So management of diabetes mellitus. So if you have already been diagnosed, what is the management? You should have a glucometer at home, blood sugar monitoring machine at home, which is called the glucometer, where you check your blood sugar regularly. It must not be too high, it must not be too low. Then if it's the type 2 type of diabetes you are having, you place on oral diabetic drugs based on the category that your physician placed you on. So please take your drugs regularly. So insulin will be administered for people that have type 1, because the pancreatic cells that are supposed to produce the insulin is damaged, so they will need to give them insulin. So this insulin, it has different types which have different mode of action. We have the injectable insulin, the syringe insulin, insulin pump, rapid acting or inhaled insulin. Any type of insulin that is prescribed to you by your physician should be taken. Then diet is also very important. Foods such as ofada rice or ripe plantain should be eaten regularly, and reduce the level of your carbohydrate intake. Also do exercise. This increase insulin sensitivity. Prevention of diabetes mellitus: let's eat healthy, let's eat less of junks and eat balanced diet, vegetables, high protein. Eat the 6 classes of food, but in their right proportion. Physical exercise: let's try to do exercise from time to time. Let's limit the amount of alcohol intake, because alcohol too causes diabetes. So what I meant by following your treatment regimen is sticking to your the prescribed medication and also the diet. The diet is very, very important in the management of diabetes mellitus. So also the foods that diabetes mellitus patients should take more is reduce carbohydrate intake. It's not as if you will not take it at all, because you still need the carbohydrate, but in low level. So the food that you should increase is protein intake, vegetables, fruits, ofada rice. If you want to take carbohydrate, don't take the normal foreign rice. It has been noted that ofada rice is having low level of starch in it, so you should take more of ofada rice. Water yam, unripe plantains, not the ripe plantain, because the ripe plantain is sweet. Also beans, cornmeal, guinea corn, boiled groundnut, akara boiled, anything that is made out of beans, you are free to eat it. Akara balls, tiger nuts, coconut drinks. You can even make your food interesting. I know it's not that easy to stay off other food. For example, if you are eating this ofada rice now, you will eat small rice, then you can get plenty vegetables with plenty of fish inside. You can make your food look very beautiful. If you want to eat yam, it's most preferable you use water yam, but you make the yam very small and do what? Put plenty vegetables and fish, protein. All this will help to reduce your blood glucose level and also to regulate it. So thank you so much. I hope we learned a lot from today's health and wellness with Nurse Taiwo. The topic is so bulky, I can't just shorten it because I need to pass a lot of information. So if there are questions, you can drop it at the comment section. Please don't forget to subscribe to my YouTube channel. See you all next time next week. Thank you so much.